Hello, and thank you for joining us tonight for our free webinar, Cosmetic Facial Acupuncture, the Necessity of Treating the Neck, Lower Face, and Scalp when Enhancing Facial Appearance, featuring Michelle Gellis and Shellie Goldstein. My name is Jeff Bloom, Education Marketing Manager here at L.A.C. OMS. It is great to be back with all of you after the short hiatus in webinars, and we do hope you've all been as well as possible. For over 40 years, L.A.C. OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. We recommend viewing the webinar in Chrome, Firefox, or Safari, as you may experience slowness in other browsers. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of the guest speaker, please make sure to use the Questions tab, and we're going to go and do all of the Q&A at the end with Shellie and Michelle. And then please note each webinar is recorded, and immediately following the conclusion of the webinar, you will all receive an email with a link to view the video on demand, as well as a copy of the slides. You may always visit our blog and use the free webinar tag to find all of our previously recorded events. From sports acupuncture to Chinese herbs to practice management, you'll find something interesting for every practitioner on the L.A.C. OMS blog. I would also like to mention a great new feature at L.A.C. OMS. We just launched our new L.A.C. Direct program to allow practitioners to recommend products to patients and receive a commission on those purchases. We'll share a link in the chat to our blogs where you can learn more how to access this program using your current L.A.C. OMS account. Now for our featured speakers. We are proud to introduce Michelle Gellis and Shellie Goldstein. Michelle is a licensed and board-certified acupuncture physician. She's been a faculty member and clinic supervisor at the Maryland University of Integrative Health since 2004. Ms. Gellis holds the distinction of being one of the very few acupuncturists in the country certified to teach facial acupuncture internationally, and has been doing so for 15 years. And you can learn more about Michelle and her upcoming courses by visiting facialacupunctureclasses.com. There'll also be a link in the email afterwards to that. Now, Shellie Goldstein. Shellie has 28 years of practice in clinical acupuncture, specializing in cosmetic facial acupuncture, skin, and a wide variety of skin disorders. She has 12 years experience teaching cosmetic facial acupuncture, skin, and related skin conditions, and has extensive experience working in hospitals and a wide variety of medically oriented outpatient settings. She is the founder of the Academy of Advanced Cosmetic Facial Acupuncture Training and Mentorship Program. She's also the author of the book, Your Best Face Now, Look Younger in 20 Days with a Do-It-Yourself Acupressure Facelift. Please join me in welcoming Michelle Gellis and Shellie Goldstein.
Well, hello, I'm going to start. I'm Shellie. So today we'll be talking about the necessity of treating the neck, the lower face, and the scalp when enhancing facial appearance. And it's very interesting because there are a lot of facial acupuncture classes, but people generally don't focus on the neck, and it is so important, and we're going to show you why today. So I'm talking about the neck and the lower face, and then we'll turn it over to Michelle, and Michelle will teach us more about the neck, the lower face, and needling the scalp. Just for orientation's sake, when we analyze the face, we are going to divide it into upper third, middle third, and lower third. The upper third encompasses the forehead, the eyes, just to the bottom of the lower orbicularis oculi, the lower orbit of the eyes. The middle third extends from the middle of the face, starting at the lower portion of the eye orbit, and extends to the space between the nose and the mouth. And then the lower third is from the space between the nose and the mouth to the chin area. In our younger, more youthful looking years, we see the bottom of the triangle is at the upper portion of the middle third, and it creates a wide open expression in the face. As we age, that width drops to the bottom. So we begin to see the weight of the face, which used to be high in the arches of the zygomatic area of the face with a more pointed, sculpted jawline. We begin to see that weight shift so that we get a jowly area in the lower portion of the face and the jowls, and the center of the face flattens and deflates. So it makes you look and feel as if you're old, but in fact, what's happening is weight has simply shifted from the upper portion of the face to the bottom portion. So we begin to see the consequences of that. And what we begin to see is the forehead starts to shorten, and then we see creasing across the forehead. And as the center of the face deflates, it begins to move medially. The skin and the tissue and the fat starts to move medially towards the center of the face, towards the nose. And we start to develop that nasolabial fold, the fold from the nose to the corner of the mouth, and the commissural line, which is from the corner of the mouth to the jawline. Sometimes we call it a marionette line. And then in the neck, we start to see creasing and wrinkling in the neck area. Now, these changes can be due to a number of things. It can be due to changes or alterations in the skeletal tissue. It can be soft tissue changes, whether it be muscle changes, fat changes, or skin. For our purposes today, we're going to really focus on the muscles of the face. And we will talk about the muscles primarily of the scalp area, the lower face, and the neck. So all of the muscles, muscles in general, are surrounded by and covered by fascia. What's very unique about the face is that it's a layer of superficial fascia called the superficial muscular aponeurotic system, or the SMAS layer. The SMAS layer, unlike regular fascia that encapsulates or protects muscles, the SMAS actually connects the face muscles to the skin. So when we smile or laugh or cry or animate our faces, it's the SMAS muscle, or that SMAS tissue, that's in action, that's creating what happens below on the muscular level and experiencing it on the surface of your skin. So when the neck muscle, pull down on the SMAS layering, and the SMAS starts to sag or pull downward, it actually creates the corners of the mouth to turn down, the cheeks begin to deflate, and then the neck tissue drops. And we're going to go over a lot of acupuncture today that are going to help to lift that face up, lift your face, open it, and replace its natural contour. The craniofacial muscles, we call them the superficial mimetic muscles. There are muscles of expression. There are about 20 flat skeletal muscles. They lie under the facial skin. They originate or attach to the skull, and then they radiate to the surface of the skin by attaching to that SMAS layer. They generally are positioned around the openings, the mouth, the eyes, the nose, and the ear, or they stretch across the neck, which we'll go over in detail. And when they contract, rather than moving bone, they move skin. What's unique about these muscles is on the face, they are supplied by the facial nerve, or cranial nerve 7, except for the area in the cheek area, the muscles of mastication, and those are supplied by the trigeminal nerve. So here they are. And again, the uniqueness of these mimetic muscles, or these superficial muscles of expression, is rather than moving bone, they move skin. So for example, if you take your arm and you flex your bicep, what happens? The lower portion of your arm comes up, your hand and your bones lift. You relax your bicep, they go down. It's the exact same thing on the face, except that it's not bone or attachments that are being moved, but it's rather the skin or the other muscles. So just to go over them briefly, here's the orbicularis oculi, the muscle that surrounds the eye. The muscle on top is the frontalis, and the muscle on the side is the temporalis. In the mid-face, here's your orbicularis oculi, your orbicularis oris, the muscle around the mouth, and you have your levators. So levators lift. So you have your levator superioris, the zygomatic major and minor, and the risor. So these muscles are going to actually lift the upper lip, the side of the lip, and a corner of the lip. You have your masseter muscle, which is your chewing muscle, and then you have muscles that actually pull the mouth down, and they're your depressors. So you have depressor anguli oris, inferioris. They're going to pull the corner of the mouth down, the inner corner of the mouth down, and then the mentalis is actually going to lift up and create creasing between the lower lip and the jaw area. And then on the neck, you have this big band called a platysma, And then underneath it, you have the sternocleidomastoid muscle. So here's the platysma muscle, and it's one of the most important muscles of the neck that we'll be talking about. So there's a big, wide, flat band of muscle that covers the entire neck area. And if you reflect that muscle or pull it away, what's underneath? You have the SCM, sternocleidomastoid muscle. You have more levators, you have your scalenes, and your traps. All of these become really important when we're treating the neck. In the back, you have your semispinalis capitis, the splenius capitis, and the levator scapula. And then you have a set of muscles in the front that we're going to talk about, and they're part of the hyaloid muscles. So let's look at these. Here you go. Here's the hyoid bone right here. And above, you have a layering of the suprahyoid muscles, primarily the geniohyoid, the digastric, mylohyoid, and the stylohyoid. And then underneath, you have a layer of infrahyoid muscles, which attach below the hyoid bone. Most important for us is digastric and the mylohyoid, mainly because they attach to the mandible or the lower jaw. So if you take your fingers or your thumbs and you press beneath your, go ahead and do it, press beneath your chin and swallow. So when you swallow, you should feel a downward pressure. This is actually the digastric and the mylohyoid muscles being contracted. So when they contract, they're going to pull the neck muscles down, and they're going to actually open the jaw area. Now, when you talk about needling, the neck, the muscles of the neck, we think of muscles as these big, ball, bunchy pieces of tissue, but in fact, they are not the case on the face, head, and neck. Here's the SCM right in here. Here's splenius capitis, and look how thin it is. It's very flat sheet. You can see it in the front too. Here's the platysma muscles gone. It's been reflected off. But here's the SCM along here. Here are the hyoid muscles above and below. Here are the scalenes. So as you can see, they're very, very flat muscles. So when you needle perpendicularly, you are actually going to affect a number of layers of muscles. If you want to capture a single muscle, and Michelle is going to talk about this later, you need to angle differently. But the point being is that they are very flat, they're very thin, and it's very easy to affect a number of muscles at the same time, depending upon your angle of insertion. So for me, the platysma muscle is one of the most important muscles to affect the lower face and, in fact, the rest of the face as well. The platysma muscle, again, is this nice, wide, flat muscle. It originates from the skin over the lower neck and inserts into the upper lateral chest area, right below the clavicle. And it sweeps up and inserts into the inferior border of the mandible and into the skin at the lower face and the angle of the mouth, right in here. Here you can see it. So this is how it interfaces with other muscles. This is, just for orientation, this is the jaw area, the mandible, the border of the mandible. This is actually the corner of the mouth right here. The platysma is this flat band of muscle that sweeps up over the neck, over the jaw area, and into the corner of the mouth. This is the depressor anguli oris right in here. So as you can see, they're all attached. They're attached together, so when one is affected, the other is affected. So as the platysma descends the skin of the neck and pulls downward and laterally, it's actually going to lower the corners of the lower lip by pulling it down in synergy with this depressor anguli oris. They're all attached. Because of its location over the mandible and the skin of the lower face, the platysma muscle plays a really important role in terms of a number of things. It opens your jaw, so it affects the bone when you're making facial expressions. It's also responsible for drawing the skin around the lower part of the mouth down and out, which creases under the skin in your lower face. So in fact, it's related to, it affects bone, it affects muscle, and it also affects the skin. It's also really important for creating expressions, because it's a muscle expression. So several expressions that use the mouth, such as surprise or confusion or displeasure, you wouldn't be able to do that without engaging the platysma muscle. Also, one of the earlier signs of aging is called platysma banding. You can see the bands of the neck like this. We used to think, and this is interesting because we used to think that these bands occurred when the platysma muscle relaxed and the skin above it became lax. But in fact, there was a really important piece of research that came out that noted that it's not the laxicity of the muscle and the skin, but it's the shortening and the thinning and the tension of the platysma muscle that creates these bands with skin laying over it. That piece of literature came out in the Plastic and Reconstructive Surgery Journal in January 2017. And what they noted, it was an observational study, what they noted was 25 patients with definitive unilateral facial palsy. So 25 people had facial palsy. 76% of these actually had the platysma bands on the healthy side, but not on the paralyzed side. So what they were able to conclude is that these platysma bands are not related to the relaxation of the platysma and skin laxity, but rather caused by activity of it. So it's the contraction. And over time, what happens is the platysma muscle starts to shorten, becomes fibrous and contract, and actually bowstrings out from the neck, and this overlying skin just drapes over it and starts sag. So this also was informative for looking at muscles in general and how muscles of the face age, because we've always thought of muscles as being lax and weakened over time. But in fact, these muscles of expression on the face, they're constantly being moved, constantly tense, constantly active. So rather than aging by relaxing and becoming weaker, they actually do the opposite. They get tense and tight and slightly dry as well. So that was kind of interesting. Now, I am a TCM practitioner. I tend to needle very simply. So I look at treating the muscles and treating aging faces as basically following the principles of TCM or traditional Chinese medicine. So I'm going to look at muscle changes and aging as directly influenced by the disharmony in the qi, the blood, fluids, meridians, the zangfu organs, and all of their systems. So for me, facial concerns, say muscle changes, muscle sagging skin, and wrinkling of the skin, is really just a symptom of something that's underlying, our underlying pattern of disharmony. So I treat the root cause, the pattern of disharmony, with body points, and then I'll go back and I'll treat the facial concerns, the changes in muscle tone, sagging skin, and wrinkles, as a branch treatment, and I'll use muscle points, either acupuncture points or motor points or any other ancillary techniques like gua sha, facial cupping, that type of thing. When we look at the paired organ systems, as TCM practitioners, we know that each of the paired organ systems have certain attributes. The heart, small intestines, pericardium, the sanjiao have an effect on the blood vessels, and in facial acupuncture, we see that as complexion. Broken capillaries, fine lines, rosacea, that type of thing. When we look at skin, I'm going to jump down here to large intestine. We know that those paired organ systems of the large intestine and the lungs, they have an effect on skin. So we're going to look at, say, texture of our skin, pore size, acne, that type of thing. We're going to address the lungs and the large intestines. However, with muscles, the systems that we're going to focus on is the system of the spleen and the stomach, our muscle integrity, the way that muscles contract, which would be under the auspices of the liver and the gallbladder, the ligaments and the tendons. So liver gallbladder is an interesting one. We see them as ligaments and tendons, but in terms of aging and facial acupuncture, cosmetic facial acupuncture, we're more concerned about the ease with which they contract, whether it's even and smooth or irregular and a bit chaotic. So we're going to look at skin creasing and wrinkling through the liver system. And of course, the kidneys are very, very important for any type of aging, and we're aging every day. So I always take a look at the kidney systems and see what's going on. So I'm going to look at their pulse, their tongue. I'm going to assess what's going on from a TCM perspective, treat the body issue or the underlying pattern of disharmony with body points, and then I'm going to move to the face. So for the neck points, there will be specific points that I use, mid face, upper face, and they're going to either fall on the meridian or off the meridian, depending upon my intention of treatment. So for the platysma, here again is that platysma, thin, flat band starting below the clavicle, the thoracic cage, and scooping up underneath the corner of the mouth. As the platysma muscle tightens, it's going to pull, because muscles pull from insertion to origin. So it's going to pull from the insertion, from along the mandible, all along here, and pull the corners of the mouth and cause wrinkling and creasing of the skin, neck of the skin. So I like to use points along the clavicular edge, whether it's kidney 27, along the neck area, stomach 9, 10. I'm going to use stomach 4 as well. So I'm treating this whole platysma area. And then there's a really interesting point here, stomach 5 right here, the yellow line, and right underneath it is a great point for tightening that or relaxing that platysma, that entire platysma area. For the SCM, I'm going to look, here's the SCM area, and you can see all of the acupuncture points along the SCM. Now, I don't use them all. I will choose a few that I like. So I just see that, you can't see my cursor, but you can see the SCM area, and you can choose points along the SCM, whether it's amion, gallbladder 12, small intestine 16, large intestine 17, stomach 9 and 11, great points. In the back, along the semispinalis capitis or the splenius capitis, I'm going to use points along that area as well, those muscles as well. I tend to like the muscles at the base of the occiput. I find them very, very effective for a number of reasons. So I'm going to use points like bladder 10, gallbladder 20, and the Ji points. The Ji points are really interesting. I'll show you where they are for those of you who don't know. They're the points on the model in the back. They run lateral or parallel to the cervical spine. So I will also use those for the semispinalis cervicus. So I'll just use GV16 plus a number of those points. And again, choose the ones, palpate the back of the neck, palpate your muscles, find the areas that are tight, and I needle there. And then on the lower face, the depressor anguli oris, the muscle that's underlined in the slide. And I will use, my favorite points are stomach 5. Stomach 4 is an amazing point because it affects the platysma, it affects most of the depressors, as well as some of the levators. So it's a really effective point, simple point that gives you great results on many different levels. And then the depressor labii inferioris, again, that origin is at the mandible and attaches in the lower portion of the jaw. And inserts at the center of the lower lip. It pulls the lower lip down and creates wrinkling around the lips and puffiness below the lip. You'll see a picture. My favorite point for that is, can you see on the skeletal, the meridians Ren 24, 1/2 Sun lateral is that extra point, and that's a great point for affecting the depressor labii inferioris. And then the mentalis, now the mentalis is the opposite. The other muscles inserted at the mandible and pull down on the lips. This actually is the opposite. Even it's going to insert on the mandible below the teeth and inserts at the skin at the ball of the chin. So when that muscle pulls down, rather than pulling the corners of the mouth, it's actually going to lift the lower jaw, and it creates a little line, a little creasing underneath the lip above the chin area. And my favorite points for that are CV or Ren 24, and that again 1/2 Sun lateral. To that is extra point HN. And you can get great results. Simple treatment, really, really effective. Here are some before and after photos. So you can see the top is the before, and you can see, well, I don't know if you can see or not, but what I see is here's that big muscle that we're working on all along here. And you can actually see it pulling, the platysma muscle pulls on the corner of the mouth. You can see the line. And then in the bottom picture, you can see the line at the corner of the mouth is actually shorter, and there's more definition in the jaw area, and the neck is actually tighter. Not only is it affecting the neck and the lower aspect of the mouth, but look at the effect that it has on the entire face. So you can see in the first picture on the left, you can see the entire, remembering the triangle, where the upper part of the triangle is at the upper mid face, and the nice youthful face, and then in the older looking face, the lower aspect of the jaw begins to carry the weight. This is the case. You can actually see the weight of the face and the jaw area and the lower portion of the face and in the neck. And this, I think, is 6 treatments, 6 weekly treatments. You can actually see the entire lift beginning to occur. The pressure from the neck is being released, and the entire face then starts to lift. Here's another before 5 treatments, 10 treatments. You can see a huge change in the definition of the jawline as the neck muscle, the tension of the neck muscle starts to shift. And then this is you can see underneath the lower lip, that little pouching area on this one. This is after 1 treatment. You can begin to see the significant changes of that little pouching area, and by treating the platysma muscle and the lower aspect of the neck. So I am now going to turn this over to Michelle, and she's going to tell you what she does.
Thanks, Shellie. That was wonderful. And you did a fabulous job of going over all the anatomy. Makes my job a lot easier. And Shellie and I do share a lot of the same foundations for treatment, where we use the TCM theory to figure out what's going on with the body systems, to treat the body points, and also treat face points as well. I am a classically trained Worsley 5-element acupuncturist. So in addition to, when I teach my classes, in addition to the body points and the face points that I use, I also kind of have a section that I teach on the emotions. And because everything that goes on in here is going to show up right here. And looks like Shellie found this same, there's this book that's circulating, and I just love it. It came out, but it's all of the different expressions and how they will show up on the muscles of the face. So I pulled a couple of them just to show like a resting face, and then someone that's enraged, and which way the muscles would be moving. If someone is happy, which muscles are being used, and to purse your lips. And you can see that you might not think, if you were enraged, that you'd be using the apicularis oris, but everything just comes together to make these different expressions. And then over time, these expressions get etched on our faces. And as I mentioned, with a kind of an idea, thinking about the elements, looking at the spleen, someone had a lot of damp, a lot of heaviness, a lot of phlegm. The neck is going to have an appearance more like the one on the left. And if someone is more kidney type, maybe yin deficient, they will have a thinner neck. The platysma band will be more noticeable, and you end up with these, they call them necklace lines. They're actually, these necklace lines are actually showing up now in much younger people, and the thinking is because everyone's looking down now at their phones, at their computers, so we're we never used to see these until people were in their 40s or 50s. Now they're showing up in people as young as their early 20s. So I kept my, when I teach, I always make my students laugh because I work on my own face, but I never liked working on my neck. But during the pandemic, I live in Maryland and I'm 59 and on complete lockdown. We were on lockdown for, I think it was 11 or 12 weeks. So I had some time on my hands. So I started working on my own neck, and I just happened to have had a picture that someone took of me from the side. I didn't even take that picture from last August. And then I took another picture of myself right before we put these slides together. And it looks like I definitely had some tightening of the laxity that was going on. And so I'm going to talk a little bit about some of the techniques that I use, one of the techniques that I use in order to get the muscles to kind of wake up and go back to normalcy. Here's a patient of mine. I have this one in black and white because when you add the color back in to the picture, it almost looks photoshopped. So I took the color out, and this is how I display it. This patient came to me. She said her husband always asked her, "Are you unhappy? What's the matter? Are you not happy?" And you can see the way the corners of her mouth were really, really turned down. And after her third treatment, she came to me and she said, you've got to take a picture of me because my husband can't believe what's going on. So it was pretty significant. Usually with something like that, we're talking 12 to 20 treatments. But she was an earth constitution type, and I really think, like Shellie was talking about treating stomach 4 and a few of the other muscles, it really made a significant difference. This was a student in one of my classes actually was doing some cupping on someone's neck. And this happened right in the class. It was a class I was teaching in L.A. and I was pretty impressed. So he had taken a before picture. I grabbed the after. So what I'm going to talk about today is submuscular needling or intramuscular needling. And what it is a way to needle into or under a muscle in order to restore it to its normal muscle tone. And the way it's done is the needles are inserted. You start at the insertion and you move to the origin. In some instances, you'll go under, and sometimes you'll go right through the margin of the muscle. And how deep you go is going to depend on how thick the skin is and how thick the muscle is. So for smaller muscles, thinner muscles, you'll be doing submuscular needling. For larger muscles or more substantial muscles, larger meaning thick, you would be doing intramuscular needling. And what it does is it brings blood and qi to the muscles. And but although I use this in a lot of muscles in the face, for today's purposes, I'm just going to be speaking about muscles on the lower face and the scalp. So the temporalis, the platysma, the masseter, the digastric, the auricular muscles, and I also do submuscular. Looks like there's a typo, submuscular. Oh, the slide got squashed. It's submuscular, one word, needling. I also do the frontalis and the corrugators, but I'm not going to talk about that today because we're just talking about the neck. So I wanted to, because I'm going to be talking about the temporalis first, and the reason why it's included here is because here we have the occipital frontalis, okay, and the Gallia aponeurotica, which is right here, connects the frontal and occipital bellies of the occipital frontalis, and the temporalis attaches all along here. And if you can follow the occipital ridge down, you can see that it comes right into the SCM. So everything is connected. The temporalis is connected here, and then all of this is connected here, and then this is connected here. And so you can't treat one without treating the other. It's all good. So by treating the temporalis, you're actually helping to lift the face. So the temporalis, as I said, it's a very thin muscle, but it's very large. It comes all the way to right around where Taiyang is, all the way in back, all the way back towards the bladder line, and it covers the temporal bone. And the origin is around the temporal line of the fossa, and the insertion is down at the mandible and all the way around the top of the mandible. So this is what it looks like here. And so if you wanted to do submuscular needling, what you would do for this particular muscle is you would take needles and you would run the needles right along the edge of the muscle. It doesn't even matter what direction you needle them in, but you want to get underneath the muscle. If you needle into the muscle, just like when you're doing scalp acupuncture, you want to get all the way down, because if you needle into the muscle, it is going to hurt. And this is what it looks like. And these are two different students in my classes that have done some submuscular needling around the temporalis. And the next muscle group, my slide's a little squished there, but the auricular muscles, which as you can see, they attach to the temporalis, and they originate at the Gallia aponeurotica, and then they insert all around the outside of the ear. You can see them on this picture here to the left. And what you would do is take like a 1/2-inch needle. I love serins for this, and just go right underneath. You want to get as close to the ear as possible. Doesn't matter what direction you're needling in, because essentially you're threading, and you're just going to get right underneath that muscle. And if any of you are able to wiggle your ears, these muscles are actually very developed in people that can wiggle their ears, and you can actually watch your face move a little bit while you're contracting these. So learning how to wiggle your ears is very beneficial for facial rejuvenation. And there are actually YouTube videos you can learn how to do it. So this is what it looks like, and these needles are muscles are needled. This is the posterior auricular, the superior auricular, and where my thumb is the anterior auricular muscle. And Shellie went over the platysma. You can see where the origin is and the insertion. It actually wraps right around like this, and then it comes right down over the clavicle. And for this muscle, what you want to do is you're always going to, when you're doing submuscular needling, you always want to go from the insertion to the origin, and you can needle in one direction and then in the other direction, and it creates a little tension on the muscle, and it really helps to rejuvenate the muscle itself. Here are here's a picture of some platysma bands, and Shellie already went over kind of what happens and how these bands form. So I have Jeff, if you can go ahead and run the video. So I'm going to have to talk over it because there's no sound, but looks like it's going a little slow. But here I am. You're going to needle right along the jawbone. You're not going to be on top or on the bottom, but you put the needles in right along the jawbone like that. And then you would go in the, that's stomach 9. The red needle is stomach 9. But you would go along the jawbone, and then you go down to the clavicle, and you can just, I like needling towards myself, so I do one side of the jaw, then I do the clavicle, then I walk around the patient and I do the other side. But when you're on the clavicle, you want to be right on the clavicle itself. You don't want to be in the lung area. And all of these, I have dozens and dozens of these short little videos. I have them on my YouTube and my Vimeo, and also I have a Facebook group where I play them and on Instagram. So that is that. You go ahead to the next slide, Jeff. So that's what it looks like when it's done. Can I go to the next slide? I guess I can. Whoa. Okay. So just looking at the platysma quickly one more time, you can see all the places on the lower part of the face where the platysma attaches. And one of them is the masseter muscle, which is this big muscle of mastication. And the easiest way to find it is just bite down. And this is a muscle where it's really hard to do submuscular needling. So, and it's a very thick muscle. If you needle into it, it's not very painful. I mean, you want to try to get under it, but if you can't, you can needle through it. And it originates at the zygomatic process, and the insertion is along the mandible. It's great for patients that have TMJ, any sort of paralysis on the side of their face. And this is what it looks like. There's my patient's nose and mouth. I guess this got cropped a little bit, but needling on either side of it will really help to rejuvenate the muscle, especially if the person is very sunk in. It will help them to kind of plump out. So Shellie was also talking about these muscles all along the front of the neck and then underneath the chin. And I am just going to talk about the digastric because that is another muscle that I do submuscular needling on. And the reason I use those is because they are the easiest they're the most superficial, and they are fairly easy to find. They're about the width of a pencil, and they attach to your jaw, and then they go back to your hyoid, and then they come back up again to the corner of your jawbone. So it looks like this, and you can see where it attaches under the jaw, and then there's little loop on the coracoid process, and then goes up to the mastoid process. So when you're needling these, this is just one more view, so you kind of see it from the front. When you're needling these, what you would do is just take your 1/2-inch needles and find the edges of the muscle, and you want to try to get underneath the muscle on both sides. And when it's done, it looks like this. Some other things that I do for the neck is cupping in gua sha. If you're doing gua sha on the back of someone's neck, because the back of the neck is connected, well, it's connected to the front of the neck and the whole neck and the scalp and everything, it's wonderful. And facial cupping and facial gua sha is a great way to bring blood and qi into the muscles, into the skin, and it's very relaxing. Gets rid of a lot of that tension in the forehead, a lot of that wood energy, and it's just fabulous. It drains lymph and lots of good stuff. So I think that's all I've got. This is just about my classes. So I've got one class coming up at the end of the month. It is going to be an interactive live stream webinar, and the first 2 days is facial acupuncture. The last day in the morning, I will be teaching facial cupping and gua sha, and in the afternoon, I am doing a dance class, and I also have a guest speaker. Lonnie Jarrett will be coming on and talking about spirit of the place on the face for about 2 hours on Sunday. And then I have another repeat performance of that in October, and all of my classes are also recorded. I have classes I teach on treating neuromuscular facial conditions, and I also have one of Lonnie's lectures recorded on the face, and then Cameron Bishop, I have a recording. These are all CEU classes of him teaching Chinese space music. So you can check out my website, facialacupunctureclasses.com. I have a Facebook group. There's about 6,000 people in it called Facial Acupuncture, and then my Instagram is Facial Acupuncture Classes. And I think that's it for me.
Okay, I would just want to go back one. See this, the Active Cups. Michelle is extraordinarily creative. So she made this, it's 2 cups and two gua sha tools, is that correct?
Yep.
And the
like you get a Target.
And the instructions are right in the insert of the box. And these are great cups. I like them a lot. I've used them. And then she also has something else that she just came. Oh, and she also has the AccuLift Derma Roller. And she has her newest creation, which we're going to show to you. It's the unveiling of her newest creation. So I have the Academy of Advanced Cosmetic Facial Acupuncture. It's a mentorship and certificate training program. It's a combination of didactic online learning and a live intensive whenever we can have those again. So, and what's nice, what I love about this training program is it's bringing all of the leaders in the field together under one roof to give you a lot of creative and different information, because as you saw today, we do things a little bit differently. And I think as leaders and mentors in the field, ideally we want to pass on our knowledge to you. You take as much as you can, and then you create your own system, because that's what we did. So we don't want you to be us, we want you to be you. And so the intention of this training is to bring leaders in the field, of which Michelle is one of them, and we will be bringing to you, starting in January, a lecture series, weekly lecture series of different classes, with each person presenting a snippet of their knowledge and then tentatively scheduled for August of 2021 will be a live intensive. Now, you don't need to do the intensive in order to take the didactic program, and you can see the details on my website at hamptonsacupuncture.com. It's the 100-hour postgraduate training program, the Advanced Cosmetic Facial Acupuncture Training Program. And there it is. Tell them about it. It's so exciting.
Well, as you can see, I am currently treating my patients on my back porch because I am 59 years old and I treat my patients at home. And my son, who is 20, well, he's a senior, but he'll be home this semester. He has asthma. So I really didn't want to be bringing my patients into my house, to my home treatment space. So this is where I am. However, I live in Maryland, and eventually it will start to get chilly. So I was trying to think of a way that I could safely treat my patient's face. And I did create like some little mini masks, which is great. As Shellie and I both said, it's, you know, there are points like stomach 4, LI 20, extra point, Ren, you just really can't get to, even with like the smallest little mask. So I started working with a manufacturer about 4 months ago. This is what I came up with. And the idea is to keep a lot of the aerosols, like I can protect myself. I can put on masks, I can put on the shield, but how do you protect your space with patients coming in and out? The New York Times just did an article, and I put it on my Facebook. I haven't gotten it on Instagram yet, but the New York Times just posted an article about aerosols, which is what we breathe out. And previously, they thought these were particles that were too tiny to infect us. But according to the most recent research, if your patient has COVID, they don't know it, or they do know it, and their mask is off, or even if their mask isn't great at protecting you, these aerosols can be in your treatment space. So this giant lucite box goes right on your treatment table. It is collapsible, so if you want to store it or whatever, it falls flat. Anyway, I just got it on last Friday, and I'm pretty excited about it. So I'm selling them on my AcuLift website for now. My son's actually taking over the business because I don't want to sell anything else. I'm more excited about my cups, honestly. But I'm hoping that this will help practitioners. I really just did not start out as a money-making endeavor, but I put a picture of it and everyone wanted one. So if you really wanted to protect your treatment space, you could create the open end. And yeah, I mean, it's certainly not sealed tight. That's not the intention. It's just to provide more protection than nothing if they cough, if they sneeze, or whatever. Anyway, so there it is. And yeah.
Well, that was amazing. So thank you to both of you. Really amazing lecture. We do have a fair amount of questions to get through. So if you guys don't mind, I will start asking. Also, so I'll tell you who I'm asking the question to, but also if you feel like, you know, the question's relevant for you as well, just go ahead and, you know, answer it, you know, afterwards. So first question is for Shellie, but, you know, Michelle, you can also answer it. Do you do a front then back treatment, or just one side per treatment, or side lying?
Good question. So I have no problem holding the back of the person's head and actually lifting and turning them and just sliding in points like bladder 10, gallbladder 20, even some of the Toji points, and just running them very superficially and then just turning them back on their, you know, so that they're on their back with their head looking up at the ceiling, and then doing the face points. So I can treat the neck in a position where they're actually looking up.
And I do the same thing. You know, the way the patient's laying, there's plenty of room between the back of their head.
Because when you think about the neck, there is a slight curve, so there's a space. It's not, the back of their neck doesn't rest flat on the table, so you can actually treat the back of the neck at the same time as the front.
All right. Next question, also for Shellie. Significance of small growths at stomach 4 and how to needle when present. Inclusion cysts or benign growths.
So are these growths under the surface of the skin or on top of the skin?
They did not specify.
So whoever was want to put it in the chat.
All right, so Alana, if you would like to throw that into the chat and
under the surface. So are you? If you are, so there's a little muscle. I think it's called the medulla. What is it called, Michelle? It's the
one that they all attach to.
Yeah, it's the
it's just
anyway. So it does stick out a little bit. So don't mistake it for the stomach for area. It should pop out a little bit. If there's a growth, I'm not sure that I would needle into it. I'm very, very careful and work tightly with a dermatologist. And so if there is something that looks at all suspicious, whether it's on the surface of the skin or under the skin, I won't needle into it without them first checking with their medical care provider.
Perfect. And actually, this question is for both of you. What are the needle gauges that you prefer for facial treatments?
I use 0.15s, 0.14s pretty much exclusively, and I use serums, so the lime green ones and the red ones.
And you do the 1/2 inch, correct? So the 15 millimeter?
Yeah. And then working around the eyes, doing any threading, I use the dark blue, the facial acupuncture needles.
I do. I also use the same. I love the serums, the 1/2 inch red tip and the green, but I also like the DBC nanos. They're great. They're designed specifically for L.A.C, OMS, and they are less expensive. Can't beat a serum needle, just but they come pretty close. So for 1/3 of the price. So.
All right. And next question, I believe this one's for Shellie, but it could be for both. Does facial acupuncture affect facial PRP treatments? Do you know what a PRP treatment is?
Are the PRP the peels?
It's the laser.
The laser. So laser is like chemical peels they exfoliate this entire surface of the skin, the acid mantle, and depending upon how deep the peel is, they take off the top, the epidermal layer of the skin. Your skin, you're talking about platelet-rich plasma.
Oh.
It's okay. So platelet-rich plasma will stimulate the production of the plasma stimulates the production of different proteins in the skin. What we're using with acupuncture is a little bit different. It's designed to create more of a generalized treatment, so it's in circulation. It's like motor points. It stimulates the muscle activity and the nerve activity, rather than just stimulating the proteins in the plasma. Do you have a comment, Michelle?
No, I mean the PRP, that's based on stem cell therapy. Right. Yeah. So I mean it's definitely more generalized. Whereas what we do, we look at someone's face and we're going for specific areas. And I'm looking in the chat box and people are saying, can you use it together? I have a general rule of thumb that I use with my patients. And that is, there are so many different treatments out there. I mean, I have pretty hard, fast lines when it comes to fillers, Botox. But with a lot of these other things, they're changing all the time. I tell my patient, you go back to the person who did this treatment on you, and you find out when you are healed, and when you find out from them if it's okay for you to have acupuncture, because it's nearly impossible to know. I mean, you hear Shellie and I, what's PRP? It's like, you know, keeping up with all the different peels and the lasers and the microderms, and there's a lot of different things that people are doing to their skin, and you don't want to tell them the wrong thing. So based on what I know about PRP, I can't think of a reason why you couldn't come together, but you would want to wait until they're healed from the injections.
Anything to add, Shellie?
No, I mean, I treat with acupuncture pretty much anything that, and so even if they've had Botox, if they've had fillers, if they've had PRP, there is a window. Particularly with something like Botox, you don't want to treat them while the Botox is affecting the muscles. And you certainly want to allow, people pay a lot of money for these services, and you don't want to interfere. Right. You don't want to do harm, you want to enhance. And so wait the window, and then it's fine to, I feel like it's fine to treat. And I see there's a question about pregnancy too, and I will even treat people who are pregnant very lightly, but acupuncture is great for pregnancy. And if you use your root treatments to nourish the uterus, then I don't have a problem putting a few needles in their face as well. Michelle, do you?
I tend to shy away from most of the acupuncture points in the face. If a patient is pregnant, I'm just concerned about too much like descending with all the food organs that you're hitting, but I will do some threading, intradermal needles. I'll do some ear points, some scalp points, things of that nature that will help to relax it. I don't have any problem doing intramuscular stuff, but I'm a little leery of like LI20 or stomach 4, but it's just like a personal preference. So.
All right. What is the TCM explanation for what is happening to the face as it is improving after treatment? Is it clearing damp, stagnation, etc.?
Yes. Go ahead, take this one, Shellie.
Okay, it does a lot. If we think about heavy muscles from TCM perspective in the spleen in terms of spleen dampness, but you don't have to have spleen dampness in order to have heaviness in the lower aspect of the face. That can be aging. It can be a number of things. It could be bone loss with aging. It can be fat redistribution. It can be loss of muscle integrity. It can be due to skin laxity. So with acupuncture, what we're treating you from your skin, your tissue, your muscle, your bone, your constitution. So we are, rather than say a facial or just simply stimulating the muscles of the face, we are treating from the inside to affect the outside.
And if you're treating their stagnant liver chi and their face is all constricted from all of this frustration, just by treating their liver, their face can relax.
Amazing. Yeah, particularly around the eyes, this really makes a huge difference.
And just think about when you're treating a patient who has a kidney deficiency and how that can help just under their eyes with the darkness. So everything that goes on here is going to show up right here.
It's true.
All right. Do either of you have any recommendations for lifting with acupuncture?
You can't create something that has never existed. So if someone who, if you like those full lips, I was born with this big fat bottom lip and a thin upper lip. I'm never going to make my upper lip as full as my bottom lip. It's just not me. But if the musculature or the tightening of the underlying tissue has caused tension in the upper lip or tension around the lips and caused them to tighten, by relaxing them, you will promote fullness. But you can't give people Botox fat plump lips unless they've already had it, and there's a reason why they're losing it.
A couple of things you can do for lips, not to bring them to more of a youthful state, not an unnatural state for them, but cupping can actually bring a lot of blood supply back into the lips. And part of the there's a lot of reason why our lips get there and this part of the mouth starts to collapse. And part of it is hormonal. And by working with stomach 4 and REN and doing some cupping, intradermal needles in those lip lines, and especially treating points in the mentalis, the rosaris, getting around the mouth with all these points, you're really bringing a lot of energy back into the area. And if you're treating your kidneys, you're treating your bones, and part of the reason why our whole mouth collapses is our teeth go to center, our mouth gets smaller, and the jaw starts to recede. So this whole area just starts to collapse in on itself. So, yeah.
All right. And then what are the points you most often use to treat deep nasolabial folds, scalp, neck, and face?
You want to start, Michelle?
So for the nasolabial folds, I actually do a technique where I thread under the, I'll thread right underneath the jawbone to create lifting, and the auricular muscles, using those helps to lift the face, and then I do some threading in the nasolabial area. So kind of all three.
So what I do for my understanding of the nasolabial fold, this isn't a wrinkle. It's the aging of the face. As the face ages, it tends to move medially into the center of the face. So a lot of, say, fat redistribution, muscle sagging kind of lands in this nasolabial fold. So the increase of depthness in it is not always due to what's going on here, but more here at the zygomatic area. So if you take your fingers and you touch the zygomatic bone, right, your cheekbone, and the muscle right underneath it, and you lift, you can actually see that nasolabial fold start to flatten out. So in addition to, you can plump this area with intradermal needles, you can use a lot of cupping or gua sha to plump the area and to temporarily fill this area. You can derma roll in this area to stimulate the production of healthy collagen and elastin to fill it in. But I also really focus on the zygomatic area and into the auricular area, say stomach 7, small intestine 18, even around the eyes. You would be amazed that if you treat the eye area and you lift this whole area up, you can actually flatten that nasolabial fold.
All right. We have a lot of questions here, so just let me know when you're getting to a point where you kind of want to wrap it up. So maybe a few more.
Sure, we're good. You good?
You guys are awesome. Thank you.
Yeah.
This question, pretty quick one. What length of needle do you use to thread the scalp muscles with?
Half inch.
Half inch, and also half inch, yeah. Or you can thread with inch, but I tend to use half inch as well. I really like half inches on the face and intradermals into the creases.
You can just be more specific.
Yeah.
Yeah.
All right, next question. Ooh, a lot of upvotes on this one. Have you ever treated the neck of a patient with hypothyroidism? What is the effect on the thyroid, and are there any changes?
I think it's great for the thyroid. I mean, I do stomach 9 is one of my mandatory points. I have a protocol that I teach, and stomach 9 I do it on everyone. it affects your hormones, and it is going to affect your thyroid. So.
Yeah, I agree. Exactly. I have no problem, and I think on the other end, it's actually quite beneficial.
All right. Do you do cupping and gua sha before or after needling?
I do it after.
I do it before.
I love it.
There you go. It doesn't matter.
I do it that way. And so here's my reason. I do it that way because my story is my patients tolerate the needles, and just so they can get the cupping and gua sha. It's like their dessert, because it's so relaxing and it feels so good. And for no other reason. That's it.
And I do it before to relax them and make them feel comfortable so they can tolerate the needles better. But also, the reason why I do it before is if there is puffiness and swelling in the lymphatic area, it helps to drain it. So you can get really good results before you put the needles in by just draining the tissue. It's almost like, I think of the Pillsbury Doughboy, and he's kind of puffy and swollen. So if you can move some of that out into the lymph area first, then I find that for me, the muscles bounce a little bit more effectively and the skin tightens a little easier.
I'm not going to lie. I'm so happy you guys had a different answer to that. It's such
Me
a better
too.
question.
This is why you learn as much as you can from everybody and you create your own system.
Exactly. Next question is, why would you choose gua sha versus cupping on the face and neck, or do you always do both?
I do both. I do the cupping, and then I do the gua sha, and they just kind of end on the back of the neck. And by that point, like they're just saying, "I'm referring all my friends to you."
I don't necessarily do both. For me, it's a time game. I have different price points for time, and so and I also will do things like microcurrent, LED. So depending upon the amount of time that I have, I will do one or the other. And sometimes if I'm finished with the treatment and I'm not 100% satisfied, I'll go back with a cup or a gua sha and kind of clean up a little bit.
Right. Let's see. Is the substance that the gua sha instrument's made from significant? What substance or material is recommended as being the most effective for the face?
I like the green jade tools, the dark green. I learned with Ping Zong, and that's what she used, and I figured if it was good enough for her, it's good enough for me. And jade is just such a integral part of Chinese medicine, and it's very cooling, it's tonifying, it's just wonderful. People ask me about pink. What's the pink?
Rose quartz. It's rose quartz.
Quartz, yeah.
I don't know anything about it.
Yeah. So the jade, particularly the darker color jade, does have a cooling effect, and it tends to be more clearing of lymph and what would I say? It's more draining in a positive way, draining lymph and sculpting. So you can use the jade for that. The rose quartz, people say that rose quartz is designed for hydration, for softening, for smoothing wrinkles. And so a lot of people will use the jade first and then follow up with rose quartz. I too like the jade. A lot of people use the rose quartz rollers afterwards to help press product in and to hydrate and soothe the skin. And then rose has that property of being, very spiritually uplifting as well.
All right. How do you feel about microneedling that estheticians are doing?
I mean, the stuff that makes you bleed, that stuff, or I don't. But there's different types.
All right.
I can answer. I have an answer. So microneedling is actually a takeoff on blossoming. So a lot of microneedling first started in the early 1900s in Germany, and they would take this wheel with needles and they would kind of drill into the skin. And it's basically the same as acupuncture. It's designed to, the needle goes into the surface of the skin, it creates a micro trauma into the skin, and then the fibroblasts come in and they stimulate the production of healthy collagen to thicken the layering between the hypodermis and dermis and the epidermis. So there's nothing wrong with it. I think you need to know how to do it. It doesn't ablate the skin. You can get some bleeding depending upon the length of the needle. So a needle that's maybe an inch deep will go into the dermal layer and create bleeding, but I think it's fine. Personally, I don't have a problem with it, and it does work. So, do you have anything else to add, Michelle?
No, I just wasn't certain if they were, because they said that the estheticians are doing. I know estheticians have machines that they use, and they'll numb the skin. And as far as derma roller, obviously, I think they're wonderful. I sell it, and I love them, and I use mine every single day. And it made a tremendous difference around my lips because the skin is so kind of thin around here, and being able to really get into those fine lines is great. And it has needles on it. How can you go wrong?
Your derma rollers, are they 0.5 and 1.0? What's the difference?
Yeah, I have 0.5 and 1.0, and then I have body rollers that are 1.0 and 1.5.
Yeah, so those are great. You know, they'll get right in there, especially the 1.0 actually gets right into the dermal layer, and the 0.5 kind of stays a little bit more on the surface. I went to, I love it. I use it all the time. Thank you.
All right. And then actually we have a few people want to know if both of you allow students into your classes and the certification program.
Well, I do, but in my live class, so in my on classes, and in my live classes, I just won't let students needle in my class, and Shellie probably has the same.
Yeah, I did. Well, if they're in their last year and they know their patterns of disharmony, they know how to their acupuncture, and they're already needling, I think that's okay. And particularly if they're graduating before it's over, but I don't want to. If they are up on their Chinese medicine information, that's fine. But we don't, in the trainings, we don't really give you a Chinese medicine primer. You have to know that. So.
All right. And then, do you do any distal points to support your treatments?
Who are you talking to?
Both of you.
Yeah, I mean, I think Shellie and I both said that's a basis. A basis of our treatment is doing the body points. And the first point I put in is gallbladder 41 to ground the patient. So.
Ditto. I do. I do their pulse tongue diagnostics and come up with their underlying patterns of disharmony, treat that with body and distal points, and then use the face points to treat what we call the symptoms or their complaints.
All right. Let's do one more question. Let's see. What can we do for large pores, open pores in the face skin?
That's another conversation.
That's another webinar.
That's another webinar, isn't it?
We just have a pores webinar.
Yeah, it's oftentimes a wind disorder, a lung imbalance.
Although, do 25, the one that helps with drinker's nose, it can help because of where it's situated on the nasalis muscle. It can actually help to tighten the pores on the nose.
All right. Well, that was an amazing webinar. I've used this material before, but if you guys have not planned to go on tour together, you absolutely should. Because really, it was such a great dynamic between the two of you, and it was really incredible information. And I really do implore all of you to visit Michelle and Shellie's websites and look into their educational offerings. They both have recorded classes. They both have live classes. So just check them out because they're both amazing teachers, as you could all tell from being here tonight. I think all of you all will get a recording link 5 minutes after. There'll also be a link to the slides. There'll be a link to some discounts at Lhasa or Mass and links to these classes that you can learn more about. We are working on getting some more webinars scheduled in the future, so stay tuned for that information. And I will just say, everyone have a wonderful night, stay healthy, and thank you, Michelle and Shellie, from the bottom of our hearts.
And thank you. We couldn't have done it without you.
This is great. Bye, Shellie. Bye, Jeff.
Bye, everyone.
Bye.
Have a good night.
Have a good night, everybody, wherever you are. And see you again.